Localization of the brain. Localization versus holistic. Before investigations, scientists supported the holistic theory of the brain, which proposed that all parts of the brain were involved in the processing of thought and action. Broca and Wernicke argued for the localization of the brain. This means that different parts of the brain perform different tasks and are involved in different parts of the body. This is proven through the fact that when a certain area is damaged in injury, associated function is also affected. Hemispheres of the brain and cerebral cortex. The brain is divided into two halves, the left hemisphere and the right hemispheres. Some functions are controlled or dominated by a particular hemisphere, and this is called lateralization. Activity on the left-hand side of the body is controlled by the right hemisphere and vice versa. The outer layer of the hemispheres is called the cerebral cortex. It is 3 millimeters thick. It separates us from animals as we are much more developed, and it appears grey in colour due to the localization of cell bodies. Brain scan evidence. So brain scans were used to demonstrate how Wernicke's area was active during a listening task and Broca's area during a reading aloud task. It suggests that the two have different functions. One is auditory comprehension and one is speech production. As they both become active within the use of different skills in the tasks, and this supports localization of the brain, as the study shows that Wernicke's area is used for language comprehension and Broca's area is used for speech production. This increases the validity of the theory. The 4 lobes. Both hemispheres have 4 lobes. There's the frontal lobe, the parietal lobe, the occipital lobe, and the temporal lobe. The temporal lobe, so at the back of the frontal lobe, at the back of the frontal lobe is the motor area, and this is where voluntary movements off the opposite side of the body are controlled. Damage in this means loss of control over fine movements. The parietal lobe, at the front of the parietal lobes is the somatosensory area, and this is where sensory information such as pressure, heat and touch, the amount of somatosensory area devoted to a particular body part denotes its sensitivity. The occipital lobe, which is at the back of the brain, controls the visual area. It sends information from the right visual field to the left visual cortex and vice versa. So, damage to the left hemisphere, for example, can produce blindness. Can produce blindness in the right visual field of both eyes. The temporal lobe controls the auditory area, and this is where we analyze speech-based information, and damage to this can cause hearing loss. Supportive evidence for this comes from the Phineas Gage case study. So Phineas Gage was trying to blast a section of rock, but accidentally exploded right by him. It caused a pole to go through his left cheek and left eye, taking most of the frontal lobe away. This damaged his personality. He became angry and rude, whereas before he was calm and reserved. And this suggests that the frontal lobe is responsible for regulating mood. However, a weakness of this study is that it is idiographic, as it's a case study, which is a unique event, and all brain injuries are unique. It's hard to make generalizations to the rest of the population. The language areas of the brain. So language is restricted to the left side of the brain. Broca's area is responsible for speech production. It was identified by Broca in the 1880s in the left frontal lobe. Damage to this area causes Broca's aphasia, which is characterized by speech that is slow, laborious, and lacking in fluency. Broca's patients may have difficulty in finding words and naming certain objects. Patients with Broca's aphasia have difficulty with prepositions and conjunctions. Wernicke's area is responsible for language comprehension. It was identified by Wernicke in the 1880s. It is in the back of the temporal lobe. Patients produce language but have problems understanding it. So, they produce a fluent but meaningless speech. Patients with Wernicke's aphasia will often produce nonsense words, which are called neologisms, as part of the context of their speech. Neurological evidence. Surgically removing or destroying areas of the brain to control aspects of behaviour was developed in the 1950s by Walter Freeman. Though these early attempts were brutal and imprecise. Doherty et al. Had 44 OCD patients, and they had their cingulate gyrus cut. 32 weeks post-surgery, a third of them had successful response to surgery, and 14% had partial response. This represents how mental disorders can be localized in the brain, which increases the validity of for brain being localized for certain functions.